my personal story started being young, playing sports, having a couple of concussions playing ice hockey, two car accidents that were notable where, I had such stiffness and spasms in my neck after that I'm sure that I experienced some not only micro tears in the tendons, but also some sub failure of the ligaments that maybe doesn't always show up on an MRI as a full thickness tear. But really, what I think is the general consensus, and people are becoming more and more aware of in today's age and the middle of 2024, is that it's most often that symptomatic generation of pain that doesn't go away when you do regular physical therapy, regular chiropractic, take some medicine, is from the sub failure of connective tissue. So, the tendons and the ligaments get micro tears, they become a little bit frayed, and then the culture in that area changes where it allows for abnormal nerve ingrowth and angiogenesis of blood vessels that aren't supposed to be inside of tendon or ligament that start to protect your body in a way, but also stimulate an even worse and progressing cascade. They protect your body, Dr. Sasha, because I think that they tell it not to fire that muscle or not to use that area because it's weak and it can't withstand the force that it previously could. But then subsequently, because you're not using it correctly and you're activating other muscles when you should be using, your trapezius, it's using your SCM or whatever the cascade is that your body developed, is that over time, the muscle that was supposed to be used gets dehydrated and gets shortened and it gets compressed and then it starts to irritate surrounding tissue. One of the most common things I see is that the SCM gets completely hypertonic and it pinches right down on the carotid sheath. So it causes vagus nerve disorders, jugular vein compression, carotid artery, forcing blood to go faster to get into your head. And the list goes on. I mean, we could take this for any area and the suboccipital and the vertebral artery connection, and then also lower in the body as well. In my
Brian,
individual
just
case,
one quick question for the people that are listening. Can you delineate the difference between sub failure and then a complete?
yeah, so subfailure may be something that doesn't even show up completely on an MRI, as it's a very small micro tear or breakdown in the tissue that causes it to lose its normal elasticity, its normal strength. And it's something that an example that I give, Dr. Sasha, sometimes just to make it in simple term, would be that if you took a stretchy band, which I have one over on the other side of the room, I'll actually grab it because I really want to show this to you. And if I were to keep it close together, but if I poked a bunch of little holes in it, so I poked a bunch of little holes, you might not see them, but as soon as I stretched it like this, those holes would become much more visible. So it's almost what happens to the integrity of the connective tissue is that at ease or at rest, you may not see it on an MRI, but once you challenge it to try to perform, is when it's going to expose that vulnerability or weakness.
Right.
So this is a big reason why you and I love to use digital motion X-ray. And even though on digital motion X-ray we can't see connective tissue, we can get an idea of what's happening to that connective tissue based on how the bones move. And circling back kind of to my case, but still finishing your question, was almost everybody has some micro tears or sub failure of connective tissue at some place in their body. And we're fortunate if it's in an area that's asymptomatic or minimally symptomatic, meaning, well, if you strain yourself too hard, you get a little bit of knee pain, or if you really are working with your hands a lot, your wrists may hurt you a bit. But the area that we see that it causes the most neurologic dysfunction and catastrophic symptoms that can be debilitating is in the neck. And that's because of how important that area is. In upper cervical chiropractic world, the C1 and the Atlas, it's a connection between your brain and your body. It's at the base of where the brainstem becomes a spinal cord. But even more recently, I've been finding that another thing that we influence with what the work we do is all of the connections between the heart and the brain. And so there's so much important neurology and circulation, blood vessels in that area that we're working to try to bring harmony with, and that's when people end up expressing health. Um, you stop me if you wish, but I was going to jump into my case now.
Absolutely. Yeah, no, that's perfect. I
Okay.
just wanted to just sort of get around the notion of sub failure, which is not visible on imaging usually, but still leads to hypermobility slash instability depending on which part of the body you're talking about. So in the knee, you would have hypermobility causing a deficient knee, whereas in the upper cervical spine, you've got hypermobility, and if it starts compressing neurological structures pathologically, then you would deem it instability, and it's a serious issue.